Namaskar. Welcome back to our discussion on the remedy Natrum Sulph. We have already done the part 1 of this remedy, in which we have covered a few general points about this remedy, like the hydrogenoid constitution of this remedy, like the discharges being yellowish greenish in this remedy, and we've also talked about the sphere of action of the remedy, which is occiput, which can be various glands in the body, especially the pancreas, and especially the action is on the liver that this remedy has, the bile, the liver, the intestines, the whole GIT is involved. We've also seen that this remedy has a great action on the respiratory system, the respiratory system producing asthma, etc. And we are going to actually talk about it in detail today, like what is the action of this remedy on GIT, on the respiratory system, and how it creates diarrhea, and what are the symptoms related to it. And that day in part 1 video of this remedy, we've covered the mind of the remedy as well, which is very interesting. This person is very sad, very irritable. He has complete aversion to life, and he has this suicidal tendency, and he especially wants to do the suicide by shooting himself. But he has a great restraint which he uses in order to protect himself from shooting. And the other important characteristic symptom was that sadness was aggravated by music, like all the natrums, and that's what we see in this remedy. Then we talked about a case related to the head related symptoms of this remedy, and the major ailments from in the head was a fall on the occiput. We've also seen that spinal meningitis was a major area of action for this remedy, like Dr. Kent has described in his Materia Medica. And then we also talked about the eyes related symptoms, the major and the main symptom being the photophobia in chronic diseases that this remedy presents with. So these were the things which we have already covered in part 1, and today in part 2 we are going to talk a lot more, and we're going to talk in detail about various important spheres of action of this remedy, like the liver. So what does it do acting on the liver? What are the symptoms that it produces? Even diarrhea, which is a very important sphere of action for this remedy. And we're going to talk about the respiratory system. We're going to talk a little bit about the skin also. So in that we're going to cover the remaining areas that we need to do in Natrum Sulph in this video right now. So going ahead, let's first talk about the action of this remedy on liver, which is a very central part in Natrum Sulph. Very important. Everybody knows that the action of Natrum Sulph is on liver. So what are the symptoms that it produces? If we know the sphere of action, but what are the symptoms? So liver, you see that the patient comes to you with symptoms, comes to you with presentation, that there is a sensation of weight that these people feel in the right hypochondrium. So there's a kind of weight. So this sensation of weight is very important. Then we see that when this patient is lying on his left side, okay, so the liver is on the right side, right? And when this patient is lying on his left side, he complains that the pain and the sensation or whatever complaints he is having are aggravated from lying on the left side, because what happens is that this liver is congested and it seems to pull and draw. So there's kind of a drawing pain when they're lying on the left side. They feel as if the liver from the right side is drawing towards the left side. Right? It is putting the weight on the left side. It is pulling down. So this it seems to pull and draw. So this kind of great weight they feel, which actually increases the pain and uneasiness. So this sensation of weight is because when they are lying on the left side, okay, there is this drawing sensation. Is compelled to turn back on the right. So the pain is so unbearable, or the pain is so much that they do not want to any longer lie on the left side. They will turn back on the right side. So this is the kind of situation that Natrum Sulph will present to us with. Now, Dr. Kent adds, now it is from these symptoms whenever a patient comes into my office. So with these symptoms, if a patient comes to his office and says, Doctor, my mouth is so slimy and tastes so bad and I think I am bilious, that he always gets Natrum Sulph. So now here, Dr. Kent actually tells us that if a patient comes to us with these symptoms, and along with that, if he has a slimy mouth, meaning a lot of salivation is there, taste so bad, so there's bad taste in the mouth, and the patient feels that he is bilious, so this is the right time to give Natrum Sulph. So the slimy thing, okay, so the salivation being a lot is a major general kind of symptom that we see in Natrum Sulph. So that's about the liver That's all about the liver, which these authors tell us, and which is very very characteristic and which can be very easily remembered. So this is what we need to remember about the liver related symptoms of Natrum Sulph. Next, moving on to the diarrhea of this remedy. So this remedy is actually very very useful in both acute and chronic diarrhea. So we can think of it in even chronic diarrhea. That is what we need to remember. So acute, there are many remedies which we think of in acute diarrhea, right? Now this is also for chronic diarrhea. So now Dr. N.M. Choudhuri very beautifully tells us about various remedies which have morning diarrhea. So sulfur has morning diarrhea. Thuja has morning diarrhea. Natrum Sulph, Bryonia both have morning diarrhea. So, but they are different, right? So what are the different symptoms that these different remedies have? So these are the very detailed stuff. Okay, these are the fine nuances that these doctors actually notice and remember. So in sulfur, what we see is that they are just they get out of the bed and they just want to go to washroom, go to the loo. So sulfur, actually what happens in this patient is that this urge drives the patient out of bed long before even it is time for him to get up. So even before he wakes up actually from the sleep, he gets the urge to stool in his bed itself. So the urge to is in his bed only. But what happens with Thuja is it's little different. With Thuja, he gets an urgent call as soon as he takes his first cup of tea in the morning. Okay, so after first cup of tea, he will get an urge. Whereas when we talk about Natrum Sulph and Bryonia, these people get stools after they get up and move about. So when they get up and they just walk around in the house a little bit, okay, that's when they start getting the urge. So in this way, even if all these three remedies have morning diarrhea, but they're a little bit different to each other, and this is how we can differentiate. Very beautifully, Dr. N.M. Choudhuri differentiates these remedies. Now, talking about the acute diarrhea that this remedy has, Dr. N.M. Choudhuri very beautifully explains the various stages, like before stools, what are the symptoms, during stools, what are the symptoms, even after stools, what are the symptoms in this remedy. And in this way, we can systematically remember the whole symptomatology that this remedy produces. So in these people, they have sudden urge for stool, and what is characteristic is that there is a lot of rumbling in bowels due to flatulence. So a lot of rumbling due to flatulence along with diarrhea. And it is mostly located, this rumbling sounds are mostly coming from the right side of the abdomen in the ileocecal region. Okay, so this is very characteristic of this remedy, rumbling in diarrhea because of flatulence. Now, what happens before stools? So before stools, the main symptom is again rumbling. Counteractive pain is there in abdomen which extends into the chest. So from the abdomen, the symptoms are going into the chest, they're extending into the chest, and we see that there's violent colic. So the painful stage. Okay, so there is a lot of pain, as if pinching. So the pain is as if pinching, and a good deal of rumbling characterizes this stage. Next, what happens during stools? So during stools, there is profuse emission of flatus with gushing stools. So obviously, because there was a lot of rumbling in abdomen bowels due to flatulence, so when then the stools are getting out, there will be a lot of profuse emission of flatus that happens in this remedy. Plus, there is voluminous feeling and burning in the anus. So there's burning and stools. So the stools are dark, bilious or green bile, maybe yellowish green, slimy or bloody. So since this remedy has a great action on liver, great action on bile, so even the stools are yellowish, greenish, bilious, dark, and sometimes they may even be bloody. So that's there. Now the stools are occasionally involuntary while passing flatus or urine or during sleep, as in aloe. So the other remedy having involuntary stools is aloe. So just like in aloe, over here also the stools can be involuntary. While they are passing flatus, the stools might come out. While they are trying to pass or passing urine, the stools might come out. Even during sleep, the stools might come out. So what did we learn is that there's sudden urge, there's rumbling due to flatulence, and especially on the right side there's a lot of rumbling going on. Before stools and during stools are different symptoms are there. Before stools we see majorly there is a lot of pain in abdomen and there is rumbling that we see. During stools we find that there's profuse emission of flatus and there are gushing stools, and we see that there's also burning in the anus. Stools we see are dark, bilious or greenish, like just like bile, because this remedy has great action on bile, great action on liver. They may be yellow, they may be yellowish green also, slimy or bloody also, and the stools may be involuntary like in aloe. And now what happens after stools? So after stools there is immediate relief of colic and the patient feels distinctly happy and cheerful. So there was a lot of colic before stools, there's a lot of pain before stools, but after stools there's just immediate relief. There's not even, it does not even take time, so immediate relief after stools of the colic, the pain, and the patient is happy and cheerful. Now Dr. Nash has actually very beautifully compared remedies. Just like we saw how Dr. N.M. Choudhuri had explained and compared remedies like sulfur, thuja and natrum sulph. In the same, Dr. Nash has also compared these remedies. He says that for morning diarrhea, the remedies that come to our mind can be like podophyllum, nufar, rumex, right? Rumex is very well known for cough and very well known for even the diarrhea like symptom, morning diarrhea, because as soon as they get out of the bed, they have the urge to go to stools. And Nufar, we see that it has a great action in diarrhea. It is a very important remedy for diarrhea. It is also acts on the male genital system. And then we see again sulfur and thuja, natrum sulph, bryonia, all of them have this kind of morning diarrhea. Then he again tells us about the remedies in which there is stools plus there is flatus emission. So a lot of flatus emission along with stools. So now just now we studied about natrum sulph being one such remedy. Then we also have China, we have Argentum nitricum, we have Calcaria fos, Agaricus, and even aloe, right? So aloe is there. Again, aloe also is similar in the, what did we discuss just now? We discussed about the involuntary stools during passing urine, during passing flatus, or even during sleep that happens. So even that aloe is similar. Then we see in this remedy, especially in natrum sulph, we see what is the characteristic symptom. The characteristic symptom is the aggravation from damp weather, which we might not see in the other remedies. There is damp weather aggravation. Then we see that when there is change from warm to cold weather, right? Warm to cold weather, or damp, dry weather. Then we see that the remedies that come up are Dellcamara and rhododendron. So in this way, Dr. Nash also compares remedies related to diarrhea very beautifully. Moving ahead, we will talk about chronic diarrhea of this remedy. When Dr. N.M. Choudhuri explains us about the chronic diarrhea of this remedy, he majorly focuses on the liver, because whenever there is an issue with the liver, a lot of changes in the liver, we often find nausea, diarrhea, symptoms such like that accompany the complaints. So what happens is, in this chronic diarrhea, we find that torpidity of the liver is at the root of this diarrhea, is what Dr. N.M. Choudhuri says. So liver is a major, main thing in this kind of diarrhea. Great sensitiveness and soreness in the, again, right, because liver is on the right side. So right hypochondriac region. There is inability of wearing tight clothing about the waist. And there is great distension, actually, there is great distension of the abdomen. So they do not want any kind of, clothing around their waist. And there is this soreness of liver to touch. Stitching pain. So the type of pain is something that we need to remember. Stitching pain, which is general in bryonia, as we remember. So stitching pain is there in natrum sulph also. Bryonia and natrum sulph are actually similar in many ways. Just like now we discussed in the morning diarrhea, both of them have the urge to stool when they walk about. Even as we go ahead and find out, talk about respiratory system, we are going to find out how they're similar even in the respiratory system. A little bit similar, not a few symptoms are similar, So just like here, over here, stitching pain is similar. Okay, stitching pain is there in the liver while walking and taking a deep breath. So these are the modalities. So while walking, while taking a deep breath, there is aggravation in the pain. Vomiting of bitter fluids. So this kind of nausea, vomiting, these kind of symptoms are there in this remedy. So, okay, so vomiting of bitter fluids, greenish brown and greenish grey tongue. The tongue is very important. It is a physical general symptom. There is loss of appetite also, qualmishness before eating, disgust for bread, great desire for ice cold water. The desire for ice cold water is there. Now, there's distension of stomach as we've discussed, and prevalence of acidity because there's this whole bilious disturbance created. So there's this prevalence of acidity, constant taste of bile in the mouth. There's yellow complexion, again maybe because of jaundice also. Constant rising or gulping up of sour water in the mouth, again a symptom indicating the acidity that they have. So these are the symptoms that he actually mentions when he talks about chronic diarrhea, because the main cause of chronic diarrhea is the whole issue with the liver. Now next, moving on to the respiratory system, but just before doing that, let's revise the diarrhea that we've talked about. So what did we talk about in acute diarrhea? In acute diarrhea, the main symptom was rumbling in the bowels, which was due to flatulence. What did we see? There was some symptoms which were there in before stools, some during stools, and some after. So what happened before stool was that there was a lot of pain in abdomen and rumbling. These were the two important things, colic and rumbling. During stools, we saw that there was profuse emission of flatus with stools, and there was burning in anus also. How were the stools? The stools were dark, they were bilious, they were greenish, yellowish green, etc. Maybe involuntary also, as in aloe. And after stools, we saw that the colic, which was a lot more painful, a problem causing symptom in the before stool stage, after stools, immediately it gets relieved and the patient is happy and cheerful. So this is something that we learnt about the diarrhea of this remedy in acute diarrhea. Now let's talk about the respiratory system. So when discussing about the respiratory system, we see that the most important symptom that the authors point out is great and constant dyspnea. Now this remedy is indicated in dyspnea, difficulty of breathing, because there's a lot of asthma in this remedy, humid asthma, just like we've discussed in part 1. Asthma is a very important part of this remedy. So humid asthma. Now, this difficulty of breathing is especially on a damp, cloudy day, because we've already seen that these people have a hydrogenite kind of constitution. So damp, cloudy weather always aggravates any kind of symptom that they have. Slightest exertion even brings on short breathing, so even exerting a little bit will lead to this dyspnea. The patient has a strong inclination to take deep and long breath, like in bryonia and phosphorus. There's copious green expectoration. So all the discharges, as we've discussed in part 1 of this video, all the discharges of this remedy are greenish, yellowish greenish. So let it be nasal discharge, let it be the expectoration, let it be the whatever the leukorrhea, etc., the stools. So all of them are of this color. There's offensive breath that we find, and there's harsh asthmatic breathing, which is audible even at some distance. Okay, and the peculiarity, which is very interesting characteristic, is that there is looseness of bowels with each attack of asthma. So just now we talked about the diarrhea of this remedy, and the diarrhea of the remedy being talked about in so much detail by various authors already tells us that this remedy has a great action on the intestines, producing diarrhea, and we already know about the asthma also, and right now we are discussing that. So both the spheres of action on which this remedy acts are now coming together. So there's both. So this along with asthma, there's a concomitant of looseness of bowels. So there's a concomitant diarrhea along with asthma, and this is how Dr. Guernsey had solved a case which had this symptom with Natrum Sulph. So that's very interesting actually. So talking about then pneumonia and phthisis, which is phthisis means TB, and in pneumonia what happens? So we talked about asthma related symptoms, and now we're talking about the pneumonia. So there's heavy pressure on chest as from a load. There's stitches, again stitching pain came up, which is very characteristic in bryonia. Stitches in chest when yawning and during inspiration. So these are the aggravating modalities. So when they inspire, there is aggravation. When they yawn, there is aggravation. Right? Now there's also soreness of chest when coughing, and it is ameliorated by pressure. Okay, so they will kind of hold their chest because it is ameliorated by pressure. So there's soreness of chest, and when coughing there's ameliorated, hence they will hold their chest. Another remedy which holds chest when they are coughing is bryonia. So bryonia, so again see there is loud rales in chest and an empty Golgon feeling which is also seen in bryonia. But both bryonia and Natrum Sulph hold chest while coughing. So there are there are a lot of similarities also. There's mucopurulent expectoration in this remedy. But one general symptom which is very different in both the remedies is in bryonia there is a dryness as a central thing to bryonia. So even the mouth is very dry, right? In bryonia. But in Natrum Sulph we've already studied the mouth is slimy. Yeah, so because must be a lot of salivation, there must be, but the in brownia the mouth is very dry. In brownia all the mucous membranes are very dry. Now in we see that hereditary. So if there is hereditary asthma, like asthma, a child comes to you with asthma, even the parents have asthma, etc. So the Natrum Sulph goes down to the bottom of such a case and will cure when its symptoms are present. So now, actually, Dr. Kent also points out towards this in great detail. He talks about how the hereditary asthma or hereditary psychotic trend is carried out and to the next generations and inherited. And Natrum Sulph can actually go to the depth of it and treat that kind of situation, that kind of psychotic tendency of the body, and it will and the asthma can be cured with Natrum Sulph. If it is hereditary, if the symptoms are present, if there is aggravation in damp weather, if the asthma is getting aggravated, if the dyspnea is getting aggravated, sinus exertion, if the discharges are yellowish greenish in color, if there's stitching pain in the chest which is aggravated by yawning during inspiration, if they want to hold the chest during cough, if this pressure is ameliorating their soreness of the chest, empty colon sensation is there, then we can think of Natrum Sulph and it will cure. So these are the respiratory symptoms which are very important. Again, the asthma being very important part of this remedy. Moving on to the skin and the fever related symptoms. So now acting on the skin, this remedy actually causes spinorrhecium. So there is inflammation, infection and all of the nail bed, inflammation and suppuration around nails, edema of feet, ulcerative pain in the soles and heels, podagra, gout. So numerous warts or wart-like eruptions on the arms, on the thighs, and anus, showing us a psychotic. So again, this shows us a psychotic taint. So already damp weather aggravation is there in this remedy, which is something that is psychotic remedies have this kind of modality. Now again, warts are also there, which again shows us psychotic taint. So numerous warts or wart-like eruptions on the arms, on the thighs, and anus are there. Condylomata and soft fleshy excrescences on male genital organs are also seen. What are the symptoms in fever? So when this patient has fever, we see that there is icy coldness of the limbs. Okay, especially the limbs are very cold, icy cold. There's absence of thirst in all the stages. Very interesting. Absence of thirst in all the stages. Bilious vomiting, which is very characteristic. We already know that bilious vomiting is something that this remedy is going to have. And aggravation in wet weather is again another symptom that we already know about this remedy, which is a general symptom which applies to almost all the ailments that this remedy has. So these are the four main symptoms in fever. So Dr. N.M. Choudhuri very beautifully has pointed out the four main symptoms. So if you remember these four main symptoms, we're done with the fever of Natrum Sulph. That is the beauty of Dr. N.M. Choudhuri. So, what are the four symptoms that we need to remember in Natrum Sulph? Two of them are very general, very common to this remedy. What is it? Bilious vomiting and aggravation in wet weather. Both these symptoms we know are going to be there in this remedy. Then what are the two symptoms that we need to remember actually? The one is icy coldness of the limbs and the other is absence of thirst in all the stages. Now, what are the dreams of this remedy? If they are very interesting and authors talk about it in detail, so we will also mention and talk about it. So they mostly have dreams about fighting, and soon after falling asleep, they start up in fright. So they will just wake up in fright, or they will just be frightened and wake up. So they'll be startling up with fear. So these are the few symptoms related to this remedy. Now let's quickly revise whatever we have just discussed. So the first thing we discussed was about the abdomen related symptoms, which mainly were about the liver. So we saw that this patient, when he lies on the left side, then he has a kind of drawing sensation in the liver, kind of pull that he feels in the liver, and that leads to a sensation of weight, which is something that impels him to turn towards right and sleep. So he cannot lie down on his left side, And then we also saw that along with this, a physical general that accompanies these symptoms is actually that the mouth is slimy in these patients, and the taste in the mouth is very bad. Then we talked about the diarrhea of this remedy, in which we talked about acute diarrhea and chronic. In chronic, we mostly talked about the liver related symptoms, right? The torpidity of the liver, the liver being not able to take any cloth around it, meaning the abdomen not, or the waist not able to take any pressure from any cloth around it, and the soreness and the stitching pain in the liver and aggravation from rocking, etc. And in acute diarrhea, what did we see? We saw that the main thing over here was the rumbling from flatulence. We saw that there were three stages, like before stools, during stools, and after stools. Before stools, we saw majorly that colic and rumbling were there. During stools, we saw that this stools were accompanied by great flatus. So flatus emission was there along with stools. Plus there was also burning in anus. How were the stools? The stools were dark. They were yellow, green, bloody, and they might also be involuntary, like in yellow. After stools, we saw that the colic immediately stopped. The patient felt relieved and happy and cheerful. Right. Then we also talked about differentials, about the comparison between remedies in diarrhea, like the morning diarrhea related remedies. Was sulfur, thuja, natrum sulph, bryonia, and Dr. Nash had added podophyllum, nufar, luteum, and also lumix. Right, we just talked about such comparisons, and then we went on to talk about the next important thing, which was the respiratory system and the symptoms related to it. So in the respiratory system, we saw major thing was asthma of this remedy, which was again having this dyspnea, in which the patient had dyspnea, which was aggravated in damp weather, aggravated on exertion, even slightest exertion. And then we also saw that this patient has this inclination to take long and deep breath. The expectoration was always, it is greenish, yellowish, right? Then another peculiarity was that Dr. Guernsey actually mentions that with asthma there might be concomitant looseness of bowels, meaning kind of diarrhea, loose bowels. Then we talked about the pneumonia that this remedy has, in which there is a sensation of great pressure on chest. Yeah, pressure on chest. We also saw that there is stitching pain in chest, which aggravated on yawning, on inspiration. There is soreness in the chest, which is aggravated on coughing, and hence the patient needs to hold the chest because it is better by pressure, just like in bryonia. And there was empty organ sensation also. Hereditary asthma is very important. Right. Then we talked a little bit about the skin related symptoms like the panorrhesium, and the extremities related symptoms also, like podagra, which means gout. We also talked about the numerous warts that this remedy has, which gives us idea about the psychotic taint of this remedy. There's this edema of the feet, etc. Okay. Then fever. In fever, Dr. N. very beautifully gave 4 important symptoms. 2 of them were common, which was bilious vomiting, common to this remedy, and the other one was the aggravation in the wet kind of damp kind of weather. The two more symptoms which were very characteristic was icy coldness of limbs and absence of thirst in all stages of fever. Right? And the dreams that this remedy has are about fights, and they're frightening dreams, so they get startled, and they wake up. So this is all that we talked about in this session lecture, that is the second part of Natrum Sulph. I hope we all learnt a lot, and let's meet again with a different remedy.